Welcome everyone. My name is Andy Smith. I am the lead content writer here at Kontakt.io. As folks join us, I want to make mention of a couple of upcoming webinars. Thank you for joining on this one. Very excited about this. Further webinars, I'll put the link in the chat to our webinar calendar, as well as my email. If you have any questions or suggestions, we'd love to hear feedback on our programming here at Kontakt.io. On February 6th, we have a webinar on maximizing your hospital's supply chain. February 20th, we have another webinar on nursing workforce job satisfaction and the role of staff safety and technology. And on the 27th, we're putting this one together now, so you're the first to know. We have a chief nursing officer webinar on preventing workplace violence, which is a little bit about what we're talking about today, but from a different perspective. Today, of course, we're talking about making hospitals safer, integrating wearables and artificial intelligence to prevent workplace violence and also, of course, introduce rapid response to some of these unfortunate incidents that seem to be continuing on the rise. Our initial speaker, Crystal, unfortunately had something come up and won't be able to make it, but I'm very excited that Tim Young has stepped in. Thank you so much, Tim. Tim is our senior pre-sales engineer at Kontakt.io. And today, thank you, there's the agenda. Tim's going to talk a little bit about what we do here and some of the solutions that we provide. Then we're going to look at the issues in staff safety, exploring the landscape of healthcare. Then actionable intelligence, looking at data and how we can leverage data analytics to make change. Then we'll dive into artificial intelligence insights. And finally, we'll look at some real world examples of success stories from the field. So as mentioned at the top, I will include a link to our calendar of upcoming webinars, as well as my email for anyone who wants to reach out. Meanwhile, for this webinar, if you do have some questions, please feel free to drop them in the Q&A, and time permitting, at the end, we'll get some answers for you. So without further ado, I'll turn it over to Tim. Tim, thank you for joining us today. It's great to see you as always. Please take it away.
Thanks, Andy. I really appreciate that. Hello, all, and welcome. We are Kontakt.io, and our primary focus for you all is to optimize your care delivery process through some digital transformation. And simply put, this means we're focused on freeing up nurses from administrative tasks and getting them back to the bedside. And not only back to the bedside, but while they're there, making sure that they feel safe and valued. Additionally to that, and that's kind of going to be our focus for today. But in addition to that, we're also looking at optimizing workflows for clinical engineering or biomed, making sure they know what needs to be repaired, replenished, gathered, replaced, and where those items are. And on top of all that, we're looking at increasing the patient experience and their journey from check-in all the way to discharge. And amongst kind of those topics, we're currently solving for about, I don't know the exact number, but over 20 different healthcare use cases. Our focus today, though, is going to be about just one of those use cases and how we can enable you to curate a workplace environment that makes employees feel safe and valued. And those are kind of two words you're going to hear me reiterate over and over again throughout this webinar. And not only making the workplace safe for nurses, but other staff members inside your facility as well. So you may have all seen the headlines and unfortunately are also most likely experiencing these same stories in your own facilities. We see stuff like 1/3 of nurses are planning to quit the profession. Nurses are listing a safe environment as the #1 priority for them. 1 out of 4 nurses are reportedly assaulted on the job. A few other headlines. And finally, one I just saw recently, nurse retention. It's not about pizza and tote bags, which is someone trying to put a little laughter on the situation, but it does underscore how important this is and how everyone's trying so many different things to solve it. Unfortunately, the issues pushing these headlines and the issues being volatile patients and family members, threats, emotionally charged situations, even physical assaults, and just generally unpleasant confrontations. These have been a continually growing issue, definitely one that predated the pandemic, but was for certain exacerbated by it. And more facilities are finally looking to technology rather than pizza and tote bags to see how it can help their staff feel safe and valued. So how do we foster that safer workplace? A good place to start is by providing staff with a means to call for help when they need to. And this is typically in the form of a mobile wearable that can be worn and discreetly pressed and easily pressed when the need arises. And this means, when I say easy and discreetly, this means you don't need to walk across the room to pull a cord or pick up a red phone and make a call. Needs to be easy and discreet. Those are very key words. And once we have a solid workflow surrounding calling for help discreetly and receiving that help, and staff start to feel safer knowing that they're being heard and also that someone is ready to come help them in case they do need help, then we can layer on additional tools like artificial intelligence and even simple dashboards to provide actionable insights for us to make proactive decisions moving forward. And you bring all those kind of disparate pieces, the wearables, AI, workflows, by following, there's really just a simple delivery methodology. You start by selecting the right network, meaning a good IoT infrastructure layer that's built on something like the open standard BLE, and this can be from Kontakt.io or another access point vendor. Then you decide, all right, what's the data, the metadata that I'm interested in? What do I want to capture? How does that fit into the solutions I've got on my roadmap? Let's make sure the solutions I'm looking for have some use case centric web applications, and all of this stuff finally being wrapped up as a service that's available to be installed, tested, and deployed in a very swift manner with staff being trained on it. And a plus on top of all that is being cloud delivered and secure and built with healthcare in mind. Now that we have, I just wanted to get that kind of framework for implementation and where to start and how to end, so that we have an idea of all this in the back of our mind when we're talking about this response workflow, which I think is really important and is very critical. And this is a workflow that I've seen at a lot of different conferences, a lot of discussion about this, and it's important for us to kind of sit here and talk about it. So in the staff safety world, we have what we'll call a time domain, where we see that the longer an incident goes on, so from the moment of an incident to the resolution, the longer it takes to resolve, the higher the risk of a severe incident. And this comes back to your training in de-escalation. Let's get ahead of the issue rather than let it grow to something bigger. And conversely, the faster we can resolve something, the lower severity, the lower the risk of severity. And all of this starts from the workflow with an incident. And traditionally, with using some legacy RTLS systems or the pull cords and phones I mentioned, we're able to send a notification to dispatch or a unit manager, who then has to triage. make a decision on, oh, this is for this type of incident. I know what they're talking about. Oh, I see the light. That means X. And they're sending that information and notifying groups that are responsible for responding, which is most likely security, but others responsible for coming for help, nearby coworkers, etc. Then they're en route. And finally, we have them arriving, de-escalation, someone's gathered, and we have a final incident resolution. And what this does is it leaves us with what we call this response gap, which is a very long time that it takes between your notification to dispatch and responders arriving, which this could be drastically shortened if we're using technology in the right way, pulling us closer on this sliding scale to our lower risk for a severe incident. So what we want to do is modernize that approach where we're reducing, or again, maybe completely eliminating that response gap and moving to a faster response resolution. So what does that look like? Starts very similar to the same way we have before. There's an unfortunate incident that is a trigger, volatile patient, an aggressor, uncomfortable situation, whatever the case may be. We press our easily and discreetly held badge to call for help. And now the system is skipping that response gap that we saw earlier straight to the groups that we've already pre-assigned to respond for these sorts of events. And these are people either floating around the facility, nearby coworkers, and we arrive, we resolve the incident in a quicker manner for a couple of reasons. One, because we're closer than we were, and we already automatically know who needs to respond. So we're arriving on scene quicker, meaning de-escalation can happen faster, and we move to incident resolution much sooner. Again, focus here being the farther we get over on the lower severity slide of the scale, the more successful and safe and valued staff members are going to be. So in addition to optimizing or modernizing that workflow, another key piece of the solution to staff safety is actionable intelligence, and what kind of intelligence can we actually get from the system. And every event we're sending, you're going to get information with the 5 Ws, and this is your classic who, what, when, where, and why. The who is going to be the badge wearer. Every individual is going to be assigned a badge. It's their own, it's part of their uniform. And the event for a press will be pre-configured. It'll be called distress, duress, whatever you'd like to call it. That's our what. When is an automatic timestamp of when that button was pressed. And also we'll get additional when information for when did physical responders actually make it to that location? Because now security and other coworkers are also wearing a location-aware badge. And when they arrive to the scene, we can pair that timestamp to say, Andre had pressed a button in emergency room 1, 10 seconds later, Andy showed up, and now we had an arrival on the scene. And maybe 15 seconds later, security actually arrived. Those are kind of examples. And then we have 2 additional timestamps in a software acknowledgement on the user interface or via mobile, and then a resolution opportunity where additional notes can be added. The where, kind of already mentioned, system's location aware, so we know at the time of the button press and beyond where the incident is occurring. And the why can be kept in the quick resolution notes that can be used for a debrief at a later time. And speaking of debrief, it's like I organized that transition. What the system will do is provide you with an automatic incident report. So everything we just saw on the previous screen, all the 5 Ws are automatically saved and available to review at a later date. And this gives a simple downloadable document for different teams to review, if need be, what actually happened during this incident. So we're getting how long was the entire incident open for, from button press to complete resolution, And then what notes were there written in there after resolution. So for this instance, it looks like, hey, the patient was confused and didn't know who Andrea was. Maybe this is a dementia patient. Pavel arrived, and together the two de-escalated the situation. And I having something automatically created and downloaded is very important, because unfortunately, a lot of incidences are going unreported because staff are already spending too much time on administrative tasks. And maybe the last thing they want to do after a stressful situation is sit down and talk about it more, or go find a forum they don't know where to even access, fill out a bunch of information that may or may not be accurate based on who was all involved. They just want to go about, get back to work on their caseload and the other tasks that need to be done for the day. So having this automatically saves 95% of the time. And if there is chance for a debrief, then there's a small spot for notes. After we do this workflow and automatic incident reports, now we can start to look at data and how we can make changes to your workflow, to your rounding, and to other staff issues. And this is something I've seen a lot over the years, and just recently saw at a conference. If you were there, you might recognize this beautiful Excel spreadsheet where a facility was trying to wrap their head around where they need to be spending time on rounds for security. And we're keeping track of all alerts by time of day, by time of week in Excel. And I know the world still runs on Excel, but for a few things, moving towards some dashboards and automated reports will greatly increase your productivity and make life easier for all of your employees. And what we've done now is, by taking your old school manual inputs and turning this into a modern automated dashboard, that at a glance you can see on Tuesdays between 10 and 11 p.m., I'm receiving a much higher incident rate than I am at other times a day, especially at the SICU nurse station. So we're doing our debrief in the morning, or our shift change for the day, saying, hey, just a heads up, it's Tuesday. Let's make sure we round around the SICU nurse station to try to stay ahead of this. Be there before anything even happens. Additional information you can gather is identifying and maybe validating for you with some hard numbers and a nice little graph which staff members or which groups are at the most risk. And our assumption is, based on everything we're seeing, it is nursing, it is staff that have direct patient care. But with other staff members also being badged, we might get an indication of how much more at risk they are than we previously knew, and can look at ways to make them also feel safer and more valued. I mentioned this physical location pairing, which is important because we get these timestamps for response details. And in our response dashboard, you'll get three very important pieces of data. One is the physical response. So how long by time of day or location, a couple different ways that we can look at this, does it take a physical response to occur? And this will help you unlock which departments might have fewer employees than you would have expected. So if you see a department with a very long physical response time to button press events, that means somebody's working by themselves in a remote part of the building. And we need to look at figuring out ways to bring more staff members close by, so if there is an incident, there's not a whole lot of wait. And now this kind of gets us to the next exciting thing, the next step. We have a workflow, button press, people respond. That's the first step of making your workplace safer. And then we have analytics that we can look at just from a dashboard perspective to review, to say, okay, this is where we need to spend more time rounding. Actually, we should have a second receptionist over here, or additional staff members to make sure that we have more bodies in a certain department. But a lot of times you might be trying to search for a question in the data that's not readily available. And what better way to make something readily available than using the power of AI to understand what we're asking, look for that piece of information, and bring it back to us. So artificial intelligence is allowing us to utilize these conversational interfaces to provide a chance to ask your questions in your own natural language and receive an answer. Hey, which different staff groups have had the longest incidences? Which unit do you think today is going to be at an increased risk for a duress event? Asking specific questions that might not be readily available from the data set, or you're looking for it in a slightly different manner, don't want to have to export and become your own business intelligence person. Simple ask and respond in ways that it, especially in the last year or two, we've become increasingly used to in other forms of content that we're looking at. And this kind of leads me into what we call the data lake architecture. And with all of this stuff that's happening inside a facility from an IoT and infrastructure perspective, and people and things moving around, there is a tremendous amount, there's a wealth of data available to help us make some operational changes and streamline things even beyond staff. But with our focus being on staff, we'll talk about kind of our steps to getting to maybe predictive models. And what we do is we have a 3-step process for this. We ingest data, so a bunch of raw data from a multitude of sources, whether it be certain databases, different APIs, IoT devices like a smart badge, different logs. That data is collected and then transferred to a cloud. Then there's this cleansing period where we'll enrich that, make it available downstream for different applications. And this is kind of where we'll normalize, do a bunch of aggregation, and apply some filtering to it. And importantly, we'll also anonymize the data. So any sensitive PII that's there that has no benefit into the analytics, that'll be removed, redacted, filtered, tokenized. There'll be a whole the whole cleaning piece there. And the reason we're filtering sensitive information, because it's not just about there was a button click from Andrea in room, can't remember which one, was it room 3 of the emergency room? But we can also pull in anonymized patient census numbers, total number of staff, total number of security on premise at a given time. And we can look at all these things to keep an eye on that historical data. And what we're doing is you bring this into our little lake house, which is providing, it's essentially a unified platform for data storage, for processing and analytics, making it much easier to derive insights from all this data. So what we're looking for here is using AI and machine learning to now predict. So rather than you having to ask, hey, what are going to be the hotspots this week for security incidents in my facility, now it's just telling you, based on historical trends, keep in mind that the 3rd floor nurse station might have an increased risk, an 80% chance of an incident today at 11 a.m. So you're looking at these things, getting actionable insight before the day has even begun of where we need to pay attention. And then from there, eventually improve down to a source of truth for the why. Okay, when our census hits X and our staff numbers drop and we have a higher patient to staff ratio, things become a little bit more tense and we're at risk for a high severity incident. And as promised, I'll get to I just picked out 2 success stories because I kind of have a slightly different views on how it came about. We're working with an 800-bed hospital in California, and they had a multitude of duress solutions, from some simple workflows like, hey, just call the help desk for help, some old pull cords, but they didn't want to continue running wiring everywhere and were looking for something that was simple and quick to be deployed. So massive building, multiple campuses outside, wanted something fast and easy, and that worked. We deployed the staff safety solution there. And once additional facilities found out, security director kept receiving questions. Oh, we're also looking into a staff program. Can we get on board with the Kontakt.io solution? And for these facilities, the answer was yes. And they rolled out each one subsequently a week for each, 1 week. Now they have a staff safe and secure way to send messages and call for help. And the outcome of all that is their staff now feel safer and safe and valued more so than they did before. And then kind of a smaller group, we have a behavioral health clinic in Illinois where they already had an existing Bluetooth network in place and were looking at increasing the time to respond. They knew they had a great workflow, but knew that things could be improved. But have gone live and they've instituted more data-driven rounding, looking at and preventing or predicting where those hotspots are going to be and applying security rounds to those areas to be proactive. And our outcome brought about for a couple different reasons, but very similar in some ways, with the outcome being the exact same, which is staff are feeling safe and valued.
Excellent,
Andy,
Tim.
over
Thank
to you,
you.
sir.
That was great. I mean, it's really fascinating how AI and data insights can be leveraged to be proactive and even preventative, beyond those tools and wearables that allow direct responses. I mean, it's really, I think it's very interesting. Um, Thank you for including your contact information there. For those who maybe joined late, my name is Andy Smith. Um, I'm the lead content writer here at Kontakt.io. My email is a.smith@kontakt.io if you'd like to reach out if you have any questions or suggestions. We do have one question here for you, Tim, if we may. We have a few minutes left. Yeah. So this question is who can receive notifications if the facility doesn't have full-time security staff? Who who is then responsible for responding, or who is going to receive those notifications?
Yeah, and a fair question because I did spend a decent amount of time mentioning security, and I do know there's a lot of locations, unfortunately, who don't have like this person saying full-time staff. So it simply comes down to whoever is responsible. And notifications can be sent to any team, any person, nearby people. It all depends on your workflow, and we would be happy to talk through that and choose the best course of action. Because in some instances, maybe a behavioral health clinic, I have seen we don't want just anybody replying to a message or to a duress event. We need to have folks with the proper training to be able to handle certain situations. So we just don't want to send that as a blanket message out, but we can be more strategic in where it's being sent to. So short answer, a lot of flexibility and whoever you want.
Love it. That's excellent. I mean, I'm very excited about some of these new solutions and how we can leverage a lot of this data and information specifically to be proactive and preventative, which is great. Um, Tim, thank you again so much. This was really great webinar. We have a number of other webinars coming up. I believe Olivia put a link in the chat. So please take a look at what's coming up, and hopefully we'll see you again at the next one. Thanks again, Tim. Thanks everybody for joining.
Thanks all.